Okay, so I'm going to show how to do a surgical prep starting with a spay clip, then a neuter clip, and then scrubbing. So first, spay clip, you're going to get your patient back up on the table. You're going to make the clip from the pubis to the xiphoid process, and to do that, you're going to end up having your clippers on. For this purpose, I'm not. You're going to hold it like a pencil, and you're going to go against the grain of the hair to get the closest shape. And you're just going to make really long, even strokes. And you're just going to do that because obviously the client wants it to look really nice. You wouldn't want your pet looking all goofy. You also are going to go about 2 clipper blades to the side of the incision site. And then once that's all clipped and nice and symmetrical, you're going to take the vacuum, you're going to put your fingers over the top to make sure you're not sucking up the skin, and you're going to suck up all the hair. For neuter, what you're going to do is almost the same thing, except not quite because it's a boy. You're going to clip from the end of the penile bone to the about first third of the scrotum, and you're just going to do the same thing. Basically, you're just going to make nice, even strokes, and again, 1 to 2 clipper blades to the side of the incision site. Sometimes, I know it's more prevalent with cats, you may have to pluck some of the hairs so you don't agitate that skin on the scrotum, but you just want that hair off. So then you'll vacuum that up as well, and then you start with your scrub. So there are 2 options that we talk about. There's chlorhexidine and there's the iodine or the betadine. And generally, we here do the chlorhexidine. It has a shorter contact time, it's less reactive and irritating to the skin, and it has longer residual effects than iodine does, whereas iodine's pretty irritating to the skin, and that's why we use the chlorhexidine. When you're scrubbing with chlorhexidine, you can scrub with alcohol or rinse off with alcohol. Iodine, you do sterile water because they react, and it's just not pleasant for the patient. And so what you're going to do is you're going to take this, you're going to kind of bunch it up a little bit. You're going to do your initial scrub with the chlorhexidine, and then you're going to come down and you're going to swoop, make your target pattern, making sure that this dirty edge always is on the outside. You're going to widen out, and you're going to keep turning, making sure that edge stays out. And then once your entire area is covered, you just come off like that. And then you can either go and do an alcohol, or you can do a second chlorhexidine to get that contact time. So then I'll just do another chlorhexidine, and then clean edge, come out and swoop, keep swooping, making that target pattern, and off. And then the third chlorhexidine, sometimes you may need more than 3, but 3 is the general minimum. If you have a really dirty patient, it can take a lot more than 3, but basically you want those coming off clean. So then you just do it again. And come off. And then take your alcohol. And then this one you're not doing the real scrub because it's the alcohol. And then you just do the same target pattern, you come off. Those should, by the end, be coming off clean, otherwise you gotta keep scrubbing. And one more. And then you can kind of, if you're getting ready to transport, you can kind of just keep a place over it just so it stays a little cleaner, and then you'll do your transport, and then you'll do one last scrub in surgery before starting the procedure. And that's scrubbing in a patient.